Let's talk about how to use vaginal dilators. The first step is to find a comfortable position, whether that be side lying, reclined butterfly position with pillow supports under your knees, or even reclined in the bathtub. So you're going to take the dilator that feels appropriate to you, and your physical therapist can help to guide to figure out what that is for you and your body. You're going to lean back, put some lubricant on the dilator, and don't be shy about it. Generous amounts can be really helpful, especially if you have dryness. And then you're going to insert it gently into the vaginal canal. And then you can kind of imagine the vaginal opening like a clock. So thinking of the pubic bone as 12 o'clock, the perineal body down here towards the tailbone as 6 o'clock, and then 3 o'clock and 9 o'clock on either side of the sit bones. You're going to stay kind of in the bottom half, so between 3 and 9 o'clock. You're going to gently insert the dilator in, pressing down slowly around the clock, or even just holding it at a spot that you feel is tight or tender, making sure that you're able to really feel the pelvic floor lengthening as you're breathing if you do feel pain, and seeing if you can gently decrease that pain level so it's not amplifying or increasing or worsening. If it is, I would back off a little bit, maybe bring the dilator out, put less pressure, or try a different side.